Hello everybody and welcome again to PCR Planet, the interactive forum to allow discussion between peers in this difficult time of the COVID-19 outbreak across the world. My name is Bernard Prendergast and I'm very pleased to be joined today by Adolfo from Argentina and by Juan from New York in the US. And today is the April the 30th, so we are many weeks into the pandemic now in many countries, and your reflections on the current situation will be very helpful and valuable for the international community. Juan, perhaps we should start with you because the pandemic has been in the US for many weeks now, and perhaps the peak has passed in New York. Tell us what's the current situation.
Yeah, Bernard, as you said, the peak already passed. This acute phase of massive number of hospitalizations, it started to decline. Our governor actually gives very good numbers every day, a very good update, and you can clearly see that number of new intubations, new hospitalizations, and admissions to ICU continues to decline. Number of cases, though, remain stable every day, which essentially tells us that infections are still active out there. And I think that everybody has to be careful not to relax all the actions taken. But at least the acute phase of hospitalizations started to decline.
And are cardiologists and specifically interventional cardiologists on the front line in New York, or are reanimation and anesthetic colleagues managing the workload?
Exactly. So the first line of defense, as it happened in other places, is being pulmonary and intensive care physicians. All elective cases have been actually canceled, but due to the fact that cases started to decrease and the load of patients going to the units started to decrease, there has been now some dialogues in different institutions in the New York area right now that started rethinking now the strategy of how to restart doing cases again.
And we've learned through some of our conversations with friends from Italy and from Spain, there are many ways in which that can be achieved by stratifying and streaming your patients. Adolfo, what's been the situation in South America? I think it's been a little bit behind the wave of infection. What's the situation in Argentina and wider in South America?
Okay, we are in the other side, in the other extreme, as is happening in New York, because here the pandemic is starting. As usual, the region is very heterogeneous, so we have different situation in different part of the Latin America, let's say, because the strategy at the beginning was different. In Argentina, we started with the confinement to be at home very early, so the curve was very flattened. Patients disappear from the hospital and people from the street, and it's a good thing. We have till now less than 200 deaths and less than 400 people with the disease that we know. But for example, maybe you know some news about Ecuador. There is a region called Guayaquil where there is a situation very extremely because the number of deaths are very high. Patients are hospitals are crowded. There are a lot of patients with the disease, so they cannot control the situation. And why our region is different as happening in United States or China or Europe, because we have more or less between 30 and 50% of poverty, and also malnourished people, and a lot of people living together, so overcrowded region. So it's going to be, I think, different from the other places. We are expecting to be very hard for us in the region.
Yeah. And Juan, I know you have a very good understanding of the South American healthcare system. Are there top tips or key messages that you can hand on to Adolfo and his colleagues from what you've learned in the New York situation?
Bernard, is fascinating because Colombia also took very aggressive, lockdown policies early on, actually even earlier than New York. And you see the curve got really, really flat from the very beginning. They have never seen a spike in cases, and the situation is very well controlled. But now we're getting to the point in some countries, and most of the countries in Latin America, as it happened in the US, in which the social unrest, related to the inability to go to work and to actually earn an income is putting a tremendous amount of pressure on society, on politicians, on the government, and is becoming really an issue. So Colombia has started a plan to restart again this week, very slowly, a progressive stage approach. And as Adolfo is saying, the biggest risk is going to be in these areas that are highly congested as they come out, if the infection is going to go up, the rates, or actually they're going to be able to control these micro outbreaks. But I have to tell you that besides Ecuador, that have really, really, hit the country very, very bad, and Brazil, that also has a high number of cases, the rest of Latin America, did the right things, and the cases are not really, the number of cases are not as bad as it happened in the US.
And Adolfo, is there any anxiety amongst the medical community, particularly the younger community, about looking after these patients?
Oh, I didn't hear very clear at the beginning. What was the question? Sorry.
Okay. Is there any anxiety, worry amongst the young medical community faced by the prospect of these patients?
Yeah, especially in this part of the society, the physicians are very afraid because the highest number of people with the disease are physicians, and we lost 3 or 4 of them, which is very bad for us. And the main problem is that we don't have all the material that we should have. So you are in contact with the patient all the time with half or less than half the material that you need. For example, special mask and dressing. So now we have a very high percentage of people, of physicians and the people working with us with the disease. And for sure it's going to get worse.
Mm. And Juan, another important priority for young doctors is their education for the future. So what do you think will be the lasting impact of COVID-19 on education programs? I'm thinking, of course, in your role as CEO of CRF, what will be the impact on international medical and cardiovascular education?
Bernard, it's actually fascinating what is happening, and it's fascinating to see that this pandemic forced us to start thinking about how education is going to look like in the next several years. And while I'm very concerned, as everybody is, for the in-person meetings, and for the ones that have been, doing all these virtual meetings and everything now for quite some time, realize the importance of social interaction. I don't think in-person meetings are going to go away, but actually I am excited because I really think we're going to be able to reach to a larger number of people that perhaps we couldn't reach before. And I think if we do it right, in a responsible way, and in a way that is very inclusive, we may even be able to essentially increase the delivery of medical education to areas that we couldn't do before. So I always look, opportunities when I see challenges, and even though I really think we're going to be forced, without any doubt, to go virtual for the next 2 years. I really think this also provides an opportunity to reach more people and deliver a more precise message to that population.
So it's always nice to end on a very positive note. So we've learned a lot already based upon the experience in New York and other major centers around the world. We recognize the challenges that will be faced, particularly in countries such as in South America, where poverty and overcrowding are a major additional concern. But we also have some positive messages going forward, perhaps, for the future of medical education on a global scale. So thank you both for joining this discussion, and I hope the content has been very valuable for our listeners. Thank you so much.
Thank you for the invitation. Thank you very much.